Hi, my name is Abraham. I'm a chiropractor here at Evergreen Rehab and Wellness. Today I'm going to go over 2 movements to help you spare the spine or reduce kind of low back pain that can come up with certain movements. When we talk about spine sparing movements, we're trying to decrease the amount of shear force that's going through the low back. Shear force is ones, if we can visualize the model here, ones that we're going kind of shifting across the spine. Once when we have back pain, those kind of movements can be very aggravating. In place, when we try to reduce the shear, what we're trying to reduce is the rotation to the spine by compression to that area by stiffening the spine. All right, and I'll show you the movement now. All right, and so we're going to show you 2 movements. One is get out of the bed and getting out of the chair. So when you're on your back, or as you're getting out of the bed in the morning, it can be very tempted to just turn and twist your back. So I'll show you the movement first, and then we'll break it down with you, okay? So first, I'm gonna slide to the side here, turn to the side, and then shift, drop the leg forward, push up to come up this way. So in that motion, I'm reducing the twisting of my trunk to get out of bed. Now I'm gonna get up with the seated position. So I'm gonna slide closer to the edge first, plant the feet, slide forward, up, and stand upright. Now there's a couple of small movements I want you to focus on when you're trying to get out of bed to minimize those twisting and minimize those bending when you're getting through those movements. So I'll do that one more time. As we come down to the bottom, I'm going to walk you through the most important aspect. Just because the table is a little narrow here, I'm going to shift to the side. You do want enough room to roll. And this roll is the log roll. The idea is that the trunk should stay, the chest and the trunk should stay in line when you turn, like that. As when you turn to this side here, what you want to do is you want to be able to have something to be able to contact to push your hand off from. So I'm going to slide it a little bit just because I don't have the space here. So once I'm here, it's important that this motion is what's going to add a lot of pressure through the low back. So we can preemptively try to protect our back by stiffening up our spine. So we can stiffen up our spine going through a diaphragmatic breathing or holding kind of that pressure to the abdomen to help stabilize the core. So what that would look like is I'm going to breathe in, and I'm going to hold the breath, and that motion I'm going to push up to get up. So I'm going to do that again now. So as you do that, you want to switch, drop the leg off the table to use as a counter pressure. As the leg draws you down, you're going to push up. All right? Stiffen the spine, and up. And that motion can take some tweaks to get a little bit smoother or to really reduce that amount of pressure at the low back, but the key is to minimize that twist, have a stiff spine, and push off to be able to get up in this position. Now when we're in the seated position, what's important is to find the pressure or find the angle that has the least amount of pressure for the low back. So you can do that through kind of the pelvic tilting, bring the hip upwards or tilting the hip back until you find a position that's a little bit more comfortable. You could also want to slide closer towards the edge of the seat. As you get close to the edge, what you want to be able to have is that stable footing. So both feet is planted on the ground, and you want the weight of the body on the heel of the foot. So as you lean forward, you're going to shift that body weight. As you shift, you don't want to be bending through the back. You're going to be hinging through the hip as you come forward. And from here, once you're ready, same thing. Take a breath in, get that stiffening to the spine with a diaphragmatic breath, and you're going to go up, push up to stand up. Okay? And that's how to spare the spine sparing movements for getting out of bed and getting out of the chair.